Hello, today I wanted to talk to you about the symptoms of pelvic organ prolapse. So some people can be walking around and not even know that they've got a pelvic organ prolapse. It might be very mild. Other people may start to feel these symptoms. And if any of these resonate with you as I'm talking to you about them, I would really like you and advise you to go to your doctors and have an internal exam and just be checked. So the first one, this is probably one of the most common ones that people come to me for. They just get this feeling of heaviness and dragging in the pelvis. And maybe they never had it before and it's just started. And it usually tends to be worse as the day goes on. So by the end of the night, there's just this really kind of painful, heavy, dragging kind of throbbing in the pelvis, and they just can't explain why. So that is probably one of the most common ones that I deal with, or the symptoms that I hear the most. So chronic lower back pain. Yes, I've had people who've never had any issues with pelvic floor, but just had chronic back pain for years, and they've seen physios after chiros, after massage therapists, and then they've eventually gone down the route of just going to the doctors, and the doctors have just said, oh, well, let's just give you an internal, and they've actually got a prolapse. So any chronic lower back pain, if you go for your next smear, just ask, or they should tell you if there's any sort of dropping of any of the organs or anything like that. And pelvic pain. So any pain in the pelvic area, if something doesn't feel right, or if it doesn't feel like it did before, please just go and get it checked out. Difficulty with sexual penetration. So yes, for some people, if an organ has shifted or moved, there can be a lot of pain having intercourse. So please, there's lots of other reasons. It could be hormonal, it could be estrogen drops, it could be that there's a hypertonic pelvic floor. So there's lots of different things like this, and also, like I said, painful sex. They kind of go together really, and an inability to wear tampons. So you either can't hold it in and it keeps dropping out, or again, it's just so painful and uncomfortable. And I know a lot of people who don't use tampons because of this reason, because they're just painful and sore. But this is just something that if it's changed, so if you used to be able to use tampons but now you can't, then that may be a symptom. It's not that if you've never been able to use them. It's if you were and you've used them for years with no trouble, and then all of a sudden you can't use them. There might be something else going on. An inability to empty the bowels completely. So bowels or bladder, depending on what kind of prolapse you have. So a bladder prolapse is a cystocele, and a bowel prolapse is a rectocele. And depending on how far that organ has dropped, depends on how far into the vaginal wall it is, depends on how easily you'll be able to empty your bowels and your bladder. So again, a lot of pelvic floor rehab can help those organs to sit where they should do again and just take that pressure off. And I always encourage my ladies to sit in front of a mirror, take their knees apart, and actually look at themselves, because that is the only way you will notice any changes. So do it now, even if you're fit and healthy. Start looking and doing vaginal exams every 3 to 6 months, because the sooner you can pick up and detect any changes, the quicker that you will get help, basically. So if tissues are protruding from the vagina or anus, then that's a sign that yes, there's different stages of prolapse. So stage 1, stage 2 tends to be it's enclosed. Stage 3 and stage 4 tends to mean that it's protruding. So and holistic core restore and everything that I do, I've worked with ladies with all different stages, help them manage their symptoms, help manage their prolapses, and we take a whole holistic lifestyle approach to prolapse. So breathing, nutrition, hydration, soft tissue, core and pelvic floor, posture, alignment, stress, everything. So get in contact if you've got any questions.